Okay, the time being 6:01 p.m. on Tuesday, October 5th, 2021. I'd like to call this meeting to order of the American Rescue Plan Committee. I'm Committee Chair Jared Sanchez. Clerk, could you please call the roll?
Bates,
Here.
Brown,
Brown here.
Ross,
Here.
Sum,
Here.
Kenyon, Leonard, Martin, Molina,
Molina present.
Strothman,
Strathman here.
Tepe,
Deppie here.
and Sanchez.
Here. Okay, this is a little different kind of a meeting. It's really only focused on listening session for behavioral and mental health. So we don't have the normal type of agenda. We don't have minutes to approve or anything like that. And in fact, we won't even need a recording clerk after this point, I think. So thank you all for coming. I want to thank you members who are present as well as online, and to our guests who are present and online. This is the first of 2 listening sessions related to the work that the American Rescue Plan Committee is undertaking in order to help us to come up with parameters for our community support grant program that is going to put $4 million out into the community in the next couple months to support things like behavioral mental health, as well as food pantries and homeless shelters. So I don't have many comments other than to say that for everyone listening and everyone attending, attendance at this listening session does not mean you are the only ones eligible for whatever grant program that we put together at the end of our deliberations. This is simply a way for the county to listen and to gain some feedback, to get some understanding of what the needs are in these organizations out in the community that are doing really great work. So if there are organizations out there who are listening either now on YouTube or listening to this some point after the meeting is over, it doesn't mean that you're out of the running. This is simply just a way for us to gather information and help us to make better decisions. So again, thank you for everyone who's able to attend. I do have a list of about 14 organizations who RSVP'd, and I see most of them in attendance. So some people just got on the Zoom call, so I'm just kind of checking them off my list here. I don't recognize everyone's name, but I will just quickly go through the list that I do have of RSVP organizations. So we have AID, Greater Family Health, Gateway Foundation, Prairie Wellness, NAMI, Eecker Center, Easter Seals, DuPage, Fox Valley, Family Services Association, Mutual Ground, Tri-City Family Services, Consumer Credit Counseling, Suicide Prevention Services, Latino Treatment Center, and Family Counseling Service. If you are, I don't think there's anyone here representing an organization. I mentioned AID. If there's anyone online, if you did not hear your organization called, please speak up now just to let me know so that I can add you to the list. Okay, not hearing anybody. All right. I think I've got those in attendance checked off on my list, and I will start with them first. The process is pretty simple for this listening session. We are going to give everyone 3 minutes to talk about their needs as an organization in the work that they do. And obviously this is going to be funneling into the work of the American Rescue Plan Committee. So in that sense, what we're looking for the most is needs in terms of operating costs. There are some organizations that would like a new roof or, buy vehicles and things like that. And they're not quite eligible expenses underneath the American Rescue Plan criteria. But certainly operating costs, regular operating costs to get things done and provide services are eligible. So I know I've talked to some of the groups here, just onboarding, getting people sign-on bonuses, things like that to help you find people to provide these services. That's one of the big asks that I already am aware of. So just keep that in mind. I'll give you all 3 minutes and we'll just see what we come up with from there. And all of this information will be collected and will be given to the committee And from there, the committee will determine what parameters this $4 million program will have. And then we'll open up a portal that will have the eligibility criteria there, and everyone can apply who is eligible. So again, thank you everyone for being here. Let's see. So we'll just start at the top of the list. And 3 minutes. My timer will go off here on the phone. Hopefully you'll be able to hear it through the speaker. Otherwise, I will let you know the time is up and to wrap up your presentation. And then I will allow, if there are any questions from committee members for these organizations, try and keep it to relevant things, something that's going to help us extract more detailed information. And one more thing, there is a questionnaire that I did ask that all attendees fill out. So I know some have not. That's okay if you have not, but I would encourage you to please fill that out as soon as possible, because that is going to be turned into one document that is easily shareable. And it will not only be shared with the county board, but also with municipalities who are receiving American Rescue Plan money that may also be able to help fund some of these services that reach their residents. So just a reminder, if you have not received the SurveyMonkey link for whatever reason, just let me know and I will send that to you. My email is jsanchez@canecoboard.com. I'll type it up on the screen later. But other than that, everyone that RSVP definitely got that link, so please fill it out. I'm looking at you, Lori. There you go. I haven't checked, so just teasing you. All right, and actually first up on my list is AID. So Lori Baker, if you could please approach the podium, just introduce yourself, and then I will start the timer.
Certainly. I am Lori Baker. I'm the president and CEO of the Association for Individual Development. We provide intellectual and developmental disability services, behavioral health services, and crisis intervention services across 7 counties. Our main county that we serve is Kane County. Last year, we served 3,700 people in Kane County at a cost to the state of about $18.6 million. There we have multiple physical locations, both residential and day services, employment services, and offices throughout Kane County. Right now, trying to get this down to 3 minutes is hard. So right now we currently have about 102 vacant positions out of a staff of about 600 plus. Our highest vacancy rate is in our direct support professionals and mental health professionals, those frontline employees. We're at a 15.4% vacancy rate when normally we run 4 to 8%. Our turnover rate is also about 25%, and it's greater than 35% among those frontline employees. So we've had to do all kinds of things in order to deal with the staffing crisis. We've consolidated a few of our community integrated living arrangements, or SILAs. We've slowed and stopped new client admissions. We've delayed reopening community day services, and we've closed 2 community day services that were located in Kane County altogether. We are unable to do much more than ensure safety for the people that we serve and support, particularly those IDD clients, because we don't have enough staff, and we've seen so much staff burnout that we have a higher frequency of reportable incidents or injuries, accidents, et cetera, that are happening during those sections. Right now, we have 47 people on our waiting list for community integrated living arrangements for people with intellectual and developmental disabilities. Those are only people from our service area. We don't put people on our waiting list for IDD services unless they currently reside in our area. That's one of the ways we try to keep our waiting list down. We also have 52 people waiting for community day services on the IDD side. 31 of those are clients that we previously supported that we can't support now because we closed those CDS sites. We can't hire people to do one-on-one supports for people that have higher support needs. And so that's been very difficult on families that have had people home for, a year and a half now or longer without any kind of support at all. On the mental health side, we have about 223 people on our waiting lists in a variety of different programs, looking for therapy, counseling, case management, supportive housing and employment services, psychiatry, et cetera. Our victim services program is seeing a 63% increase from last quarter of fiscal year 21 to the first quarter of fiscal year 22. Our street outreach program is currently working with 74 people in July, August, and September. That's up more than 45 people from the quarter before. So those are people who are currently experiencing homelessness or very unstably housed. We've already logged more hours in the first quarter of fiscal year 22 in our street outreach program. And I would say team, but it's one person in the first 8 months of the program than when we first received funding for it from CARES, from the COC Continuum of Care. Our crisis phone calls and text messages line are increasing exponentially every quarter from the beginning of COVID to now. We're seeing like thousands more each quarter of phone calls and texts. We also have about a vast increase of our sunshine calls, which are calls that we make to people from that line to remind people about their medication, check in on social isolation. About a third of those people are seniors, and so many of them don't have any family in the area. And if we're not able to check in with them daily, they could have fallen and or be injured, and no one would find them for a very long time. The things that you can do to help support the people of King County is to look at supporting the King County Health Department and becoming a hub for mental health resources, including funding for staff recruitment and retention. Also, planning and system building across King County for crisis intervention services. There were 3 mental health centers within King County that received funding from the state to create mobile crisis response teams and other crisis intervention services. And it'd be very helpful for someone at the health department to be able to help get us all together and ensure that we collaborate and that we're using those resources to the best of our ability. And it's good to have somebody outside of those 3 organizations to be that collaborative person. And personally at AID, we have a couple of capital projects going on. We're working on developing 16 acres of property that we own in Elgin. We are submitting 2 applications for permanent supportive housing and affordable housing there. So there's some potential for resource need there as well as building a community services building that would house a community mental health center. Right now, we have a little house on this property that we do mental health and employment services out of, and we're looking to increase access for people because all of us have tons of waiting lists, and there's always a need for more mental health services. Sorry, that was long, but.
Yeah, thank you. And I think with the attendance that we have, I gave you an extra minute. So
Thank
I
you.
think we'll just do 4 minutes for everybody. But yes, thank you very much for providing that information for us. It's very helpful.
And I have it in a PowerPoint if you want me to send it to you.
I was going to say, you're going to do that now? No, sorry.
I was going to, but
Tomorrow.
not in 4 minutes.
Anyone on the committee have any questions?
Well, I was going to ask you not to use acronyms, but when you were talking that fast, IDD, what is IDD?
Intellectual and developmental disabilities.
Okay. I have another question, Mr. Chairman.
Sorry.
So I think I heard Governor Pritzker say on the radio yesterday something about requiring minimum wage for disabled people. And I think that would possibly apply to your work programs. Is that correct?
It
So
would
that be-
apply to our some of our community day services programs where we provide work for people to do. It's usually piecework that people generally get paid in their ability to complete a piece of work in the same amount of time that a person without a disability would. They get paid on that scale based on that. And so minimum wage is, while I totally agree with all people making minimum wage, it also will reduce the amount of opportunities for people that have very high support needs and high complex disabilities, because they won't be able to compete with people and get jobs in the community, or it'd be very difficult.
So that will add to your operating costs.
Pardon me?
So would that add to your operating costs?
Oh, absolutely. Yeah. We don't
I
get
just,
paid.
I'm trying to get you to
Yes.
say
Yes,
Right,
it would.
costs.
That would
Okay.
cost us more money. Yes, it would.
Okay, thank
But
you.
hopefully the state would give us more money to be able to
Okay.
do that.
No
Hopefully.
more questions.
Any other questions from the committee? Okay.
Thank you.
Ms. Baker, for coming to speak to us. And it occurred to me, as she was speaking, for the other organizations coming up next, I think it would be helpful just because it is hard to condense things into a small amount of time. You guys could talk about your organization's needs and situation for a long time. So I think a good way to structure it would be just start off with what your needs are and then go into the background story, go into the background information of where you're at and the kinds of things that you're going through, so that if anything gets cut off, it's not the important part that we really want to hear. It's the stuff that we can come back to you for later. Okay. All right. So the next one, Greater Family Health. I have Nicholas DeMorest. And I apologize in advance if I say anyone's name incorrectly. I think Nick from Greater Family Health, he's here. Or somebody from Greater Family Health. I see them online. I don't know if they're.
Yeah, hi, this is Nick Demers. I have to apologize. Our CEO was unable to attend and asked me to listen in on this session, but he didn't tell me that there was a presentation component. So I
Okay.
don't really have a list of the needs identified at this time. I could share that with the committee afterwards when I speak with them later this week.
Okay, yeah. Well, there is the survey that I sent out to everyone, and if you need a link sent to you again, then we can make that happen.
Okay.
So thank you for being here and listening in. But again, the listening part really is on us, the county board. It's not much if people don't speak.
That would
So
make
I
sense.
apologize. Yeah, I apologize if that was miscommunicated in some way. So send my
Okay.
apologies. Okay.
Thank you.
Thank you. We'll move on to the Gateway Foundation. We have Teresa Garate and Carolina Strack. Carolina, is it Carolina? It's Carolina, right? Yeah.
Good evening, everyone. Thank you for having us. Laura, you did a good job. We're old colleagues, so I have to give a little shout out. I'm Dr. Teresa Garate. I'm a senior vice president with the Gateway Foundation. We actually had wanted Jim Scarpace, who some of you might know, to join us tonight. He is our local executive director here in King County for our Aurora Center, but he had a personal family matter come up. So you got me instead. So I'll start with our needs and then I'll kind of talk a little bit about Gateway. So we kind of came together and we've been through the pandemic really struggling with our census. I think some of the issues that Lori mentioned are relevant across multiple organizations. So Gateway focuses on providing treatment to people with substance use disorder, addiction treatment. We know that, before the pandemic, mental health and substance use issues were the biggest public health crisis of our time. It is the companion crisis. And just to everybody understands how bad it is, before the pandemic, the CDC reported 70,000 people dying overdose in a year. This year during the pandemic, that number went up to 93,000 and that number keeps going up. So we're almost at 100,000 people died of an overdose. Overdose death is the number one cause of injury death for people under the age of 50. So here in King County, we have been here for almost 2 decades. We have a center in Aurora that has residential, outpatient, medication-assisted treatment, as well as virtual services. What we're asking for is resources to help us enhance some of those services. So MAT, as people sometimes call it, medication-assisted treatment, is using prescription drugs to help with the treatment of people with substance use disorders. We now call it MAR, just to change things up. And to your point of acronyms, that's medication-assisted recovery. What we are missing is really a physician to help us do that work. So part of the assessment that we do, obviously, is counseling. We have 12 evidence-based interventions, but we use our physicians to help us with the medication-assisted recovery. So we don't have that. We would need a physician. We would need resources to pay for that. That's not something that we can bill for. We also have a great need in helping people integrate back into the community after they're done with active treatment. One of the most dangerous times is right after they finish their treatment. So, they've been in there for 3 weeks, 4 weeks, but they've been using substances for 30 years. So 4 weeks, might not cut it. And one of the things that happens is people relapse right in those moments after they leave. So having some resources to hire what we call community integration coordination specialists to help people kind of transition from active treatment to a long-term sober living environment. And then the third thing, and you know, you mentioned that capital probably isn't something that we need, but our center is old and we are on the 708 board. We're AID's neighbors. So we would love to explore how we could use some of the resources to enhance that and make things more accessible. Obviously, the building was built many years ago. We kind of inherited it. I think in closing, just so that people understand, Gateway, we are a very large substance use provider, but here in King County, we have very targeted supports. Our biggest need also is workforce. Somebody mentioned that. So we have been asked by the state to open detox beds. So where people can come and detox instead of going to the hospital, which is much more expensive. But we can't find nurses because we can't compete with what hospitals are paying nurses to do these detox beds. So we have the beds, but we just can't even get to the workforce. So without those nurses, we can't do that. And actually that will save the system money because our daily rate for detox is at least half of what a hospital stay is for detox. So those are the big areas, and I'm happy to answer any questions.
All right, any questions from members of the committee? Any online? Okay. Thank you very much.
Thank you for your time.
Oh, Ms. Bates, go ahead.
So you had those numbers about pre-COVID and post-COVID deaths, and I only got the 93,000. What was the before?
70,000 in a year and 93,000. That's what the CD reported in September 2020. So it comes out a little bit late because of those are deaths. So they're reported through Office of Vital Records and coroner's offices.
And that's the entire US?
That's the entire US. In Illinois, it went up about 27% across the state, almost 30%. And those are just overdose deaths. So there are people using the hospital with overdoses that don't result in deaths. And that's also an issue. I was remiss in saying this. We have about 56 people on our waiting list for Aurora. And we served about 856 people last year. So before pandemic, we were serving a lot more. It's a small center. It's only 46 beds.
So if you had to connect this to your operating expenses, your operating costs, do you know how you would do that?
Yes, so we would use it to hire a physician to help us do the MAR. We would use it to incentivize nurses to come and run our detox beds because we don't have that operating dollars to do that. What the state gives us limits the rate that we can pay the nurses. And we would try to get some of those people on the waiting list. And I'm sorry, my number was incorrect. We have 95 people on our wait list for Aurora.
56 was plenty.
I know, I know. I just looked at my notes.
95.
Yeah, almost double.
Okay, so those would be your asks
Yes.
for operating expenses.
Yes.
Mr. Chair, do we know if those are, do we think at the moment, I know we're still working this out, do we think at the moment that those are going to be acceptable expenses, or we don't know yet?
Under the ARPA, I believe so, but again, we'll be going through and going to our legal team and seeing what options.
But we think we're on the right track when we talk about needed employees and the money to pay for them.
Yeah, I mean, the state formed a behavioral healthcare workforce shortage task force as part of a statewide initiative because there is such a critical need for behavioral healthcare workforce across the board. So this is one way that we could enhance it here in Kane County.
Okay, thanks.
Thank you so much.
Thank you. Okay. I don't know that they're in attendance, but do we have anyone from Prairie Wellness? I have a Matthew Goals who signed up. I don't see that name on our Zoom call. You can always follow up after and see if they're on. So we'll go next. NAMI, we have Sarah Gray and Lauren Walsh signed up. I see both of them in attendance on Zoom. So either Sarah Gray or Lauren Walsh from NAMI, if you'd like to give your 4 minutes. And Blair, what is the unmute button if they're calling in? *6 if you're calling via phone. Okay. All right, well, we'll come back to NAMI. We'll move on for now.
There was someone on Zoom that said NAMI.
Yeah, well, there's two people, but we'll come back to them.
Okay.
Maybe something came up. How about Eecker Center? Do we have Deb Howe from Eecker Center? They can hear me, right?
I think so.
Yes, I can hear you. Can you hear
All
me?
right. Yes, we can.
Okay.
Deb Howe from the Eecker Center.
Hi.
Welcome.
Thank you. And thank you for taking the opportunity or giving us the opportunity to talk with you about what our needs possibly would be for the ARPA funds. We are interested in funding a crisis stabilization unit in our grandstand place location. This would be a place, so we already have a psychiatric emergency program within Advocate Sherman Hospital. That's where people can go, who are adults can go to, who are experiencing a psychiatric emergency. And once they get through the medical clearance and it's decided that they need psychiatric referrals, then they come to our staff that are located adjacent to the psychiatric or adjacent to the emergency room department. But there are sometimes people who need some extra support, but not so much that they need to be hospitalized. And so if they have a stabilization, a place where they can stabilize on medication, perhaps, start into some group work, create a plan. Often we use something called a RAP plan. Then this would deflect people from using the emergency room, and it would deflect people from trying to find psychiatric hospitalizations for them. We estimate there are around at least 200 people in a year's time that could benefit from this kind of service.
How many? I'm sorry.
200.
Thank you.
And those figures are, I guess, part of the year was probably COVID, and some of it is pre-COVID figures. But that it deflects people from, using the emergency room. They don't have to go to the emergency room. They could come directly to our facility. And then they wouldn't, if those people didn't qualify for a psychiatric hospitalization, but still were not, ready to be returned back into the community at home or, wherever they were living, this place would be more, a less restrictive and place for them to go. We're hoping that it would be a less than 24 hours that someone might have to be there, but they could be there longer.
1 minute.
And
Maureen.
Excuse me?
Just a 1 minute mark. Just let you-
Okay. And there would be enough room for 5 reclining chairs. Similar to what Mercy is planning, but on a little smaller scale. We have some funding for this program, so we would just need more supplemental funding to, get staffing for this program. So that's it. Are there any questions, or do you not take questions?
Any questions from the committee? Ms. Bates?
I didn't get the name of your center, please. Spell
Oh,
it for me.
Eecker, Eecker.
Okay, thank you. Another
Center.
question, please. And that's, this idea reminds me of some of the problems that we have with 911 calls. Would you be assisting the police at all with 911 calls that are really more psychiatric than, mental health crisis?
Well, we already have funding. It is a new program. AID and Family Service Agency and Eecker are being funded by the state to provide a mobile crisis stabilization teams. Not all the details have been worked out for that. But essentially, this is a place that those teams might be able to refer a person to, if needed.
Okay.
We don't know what, so it could support the police department, it could support, emergency personnel, and those mobile
Maybe that
crisis.
would be a good ask. Maybe that would be a good ask, something to do with supporting police crisis calls. Thanks.
Yeah.
Thank you.
Well, like I already said, we already have funding for that.
All right.
So this what we're thinking is something that supplements the psychiatric emergency or mobile crisis teams, a place
Okay.
for people to go. That's more
Right.
intermediate.
Thank you.
All right, any other questions? Okay, thank you very much for being here, Deb. We appreciate it. All right, next
Thank
on
you.
the list, do we have a Maureen Karwaski from Easter Seals, DuPage, Fox Valley? Thought I saw her name earlier, but perhaps not. Okay, we'll come back perhaps after. Family Services Association, is Bernie May on the line?
I am. Hi,
Hello, how are you doing?
I'm good. Chairman, committee members, and colleagues. And thank you for taking this time to, dedicating, I guess, resources to the nonprofit community, and also just taking the time to hear some of the needs that we're all experiencing as we continue to negotiate the tumultuous times that we exist in. I think what you asked for, Mr. Chairman, is like bottom line it. So I'm going to bottom line it. We need to pay our staff better is really my bottom line. And we have to do a better job being able to recruit people to get into the community mental health system. So for example, and this is certainly no indictment on the sheriff. This is, I'm using for comparison. I had a conversation with the sheriff recently about some of the things that we could do in partnership together. And he suggested that we take over one of his staff members as a social worker. And I said, I don't think that she's going to want to do that because she is going to take about a 70% cut in her overall pay based on her benefits and her salary. And the sheriff pays appropriately. We don't. So the point is that we have to be able to get into a place that our organizations have the right amount of revenue coming in the door that we're able to pay the people appropriately that come to work for us. I am embarrassed to tell you that I actually have a staff member who has a master's degree, who works full-time, who has to use Medicaid as her insurance because she can't afford to pay for her insurance on her own. So what we really need to be able to do as we move forth is to be able to get our staff in a much more equalized place equalized with other social workers, other counselors, other people who are there. Our friends from Gateway mentioned it as well. Like, we can't pay as well as the hospitals. We can't pay as well as the police departments. We can't pay as well as the others. And so then what ends up happening is that we're not able to serve the people who come to our doors because people leave us and they go work other places. And so like we have a wait list of 144 people today. Some of those folks are going to wait up to 8 months to be able to see a therapist. 8 months. Can you imagine? We serve almost exclusively children in our organization. So think about how much a kid changes in 8 months. And then they have to sit there and wait that long to be able to get their needs met as they're waiting. And what ends up happening during that time is there also is this incredible over-reliance on the crisis system. And so this is where your police officers end up being involved, and we spend the money anyway. We're spending it on emergency services. We're spending it in other places. So why wouldn't we want to spend it in places where our dollars can be used more wisely, where we can be much more preventative in nature? People are going to get the services that they need. They're just going to get them in ways that are much more expensive through an emergency room or through a police officer. And then we're still going to have to sit back and wait for us to be able to respond to them eventually anyway. So I think where we're at with most things is that we just have to be able to incentivize people to come and work in our workplaces. I would love to see Kane County as a destination employment center. Lori mentioned it in the beginning that I also believe that this could be done very effectively through our health department and working in partnership with them. I agree with her crisis coordination role as well that Lori had spoken about in the beginning as a need through our health department additionally as well. And FSA so there's also a program that's rolling out from the state that is going to be intensive care coordination for children and adolescents who are on Medicaid, that is going to add about 20 positions to our organization, which puts us in a place where we're also going to have to look at expanding our space. And so I know that that's not an operational cost thing, but we're going to be looking to figure out how do we do tenant improvements and move ourselves into new spaces and accomplishing all that within the next year as well. Any questions?
Thank you very much for that. Any questions, committee members? Anyone online, committee members?
Thank you for your service to all those people.
Thank you, Ms. May, for being here and presenting to us tonight. Okay, next on the list, mutual ground. Do we have Michelle Meyer still with us?
Yes. Hello.
Hi, Michelle. How are you doing tonight?
Good. How are you all?
Good.
Probably tired. Well, thank you all for giving us this opportunity. I really appreciate the committee. I pretty much agree with my colleagues in what they're saying. I think the bottom line, our ask would be to allow us to increase our salaries to become more competitive. I lost 6 employees in a matter of 2 weeks. Just these last 2 weeks, other jobs where they can make more money. We have a 10% vacancy rate right now. We have a waiting list of 60 people right now. Our hospital emergency room calls, so we get called out to Delnor, Copley, and Mercy, and we have to respond within the hour. Our emergency room response has been way up. Our hotline calls have been way up, basically ever since COVID started dying down. Our walk-in counseling services, like I said, that's the 60 plus people on our waiting list. We've never had a waiting list that high. We're just, it definitely could be called a staffing crisis. Here at Mutual Ground, we have about 70 staff. And so when you lose, when we have 12 open positions right now. So staff is becoming burnt out because they're trying to take on multiple tasks, and they are doing that at a reduced salary than where they could get somewhere else. So I'm worried about losing more staff and creating more waiting lists. So definitely our ask would be to increase salaries. If there was any way to get a grant for like a 3-year term that we could increase salaries for our frontline staff and then try to figure out how to sustain that after the 3 years, that would be fantastic. But I think otherwise people have talked about retaining bonuses. That would still be good. I think that they have such a hard job, and we definitely need to pay them the amount that they should be getting. We recently took over Breaking Free's substance use disorder services outpatient. Our census has been down there, but we've lost staff there too. So really, the staff are still busy seeing as many clients as they can per each of their caseloads. So overall, we just need to pay our staff, and that's the problem that we're having. And so I think that that's what we would be asking for.
Okay. Any questions from the committee? All right. Yeah, we are definitely hearing similar stories from multiple organizations. It seems to be the common problem.
Thank you, Michelle.
Yes, thank you for being here this evening and providing us with more information. All right, we'll move on to Tri-City Family Services. Is Laura Poss still on the line?
Yes, I am. Thank you so much for inviting me to be here today. My apologies. I had surgery today, so I have 10 stitches in my mouth. So I will try to speak as clearly as I can, but this was very important for me to attend today. I'm going to echo the sentiments of those that have come before me. Tri-City Family Services is a community mental health center that serves Central and Southern Kane. And we serve as young as 4-year-olds. We served almost 3,000 people last year. And to get to the point of what we need, we are in desperate need of paying our staff better, as Bernie mentioned. Retention and recruitment has become an actual crisis for us as a community mental health center. The qualified staff that we need to tend to our clients are going other places. They have so many other options. So we need to invest in them and their future so that they come to the agency and stay at the agency. I've been in this business for more than 25 years, and I've never had a wait list as large as the wait list we have now. We have over 130 people on our wait list. We do therapy, we do case management, care coordination, psychiatric services, groups, and we are seeing a desperation in the clients that are coming to us like I've never seen before. The number of people that have trauma and have been affected by COVID it's quite frankly overwhelming to the community. And I will mirror what Michelle said. We are very worried about the burnout of our staff. So in order to be able to take care of them, money for recruitment and retention would be amazing. Because of the huge amount of people that are coming to us for services, we also are looking to expand our offices. I know that's not particularly what you're funding, but it's just a reality that's on the horizon. So I think, like many of the people on the call, we're the first responders to what has clearly become a mental health crisis, not just in this community or this state, but across the nation. So I greatly appreciate you allowing us to speak up for our clients and our communities and our staff this evening.
Well, thank you, Laura, especially having had surgery today. Especially around your mouth, you spoke very well, heard you clearly. Hopefully you're not in much pain and you heal quickly.
Thank you. I appreciate that.
Any quick questions from the committee? No? Okay. Thank you again.
Thank you, Jack.
All right. Do we have anyone from Consumer Credit Counseling? Donna Rasmussen, I don't see the name on there, just in case. Okay. Suicide Prevention Services, Megan Redman.
Hello, I apologize. I got kicked off and I just got back on.
Oh, well, you're here just in time.
I too got thrown onto this meeting. I was not prepared with numbers. My executive director was unfortunately unable to attend. She had a personal emergency. So I will also fill out that survey. I do apologize. We were under the impression this was a listening for us to listen.
Okay.
Sorry.
Yeah, I'll have to look at the email that got sent out again.
Megan, what is excuse me, what was your organization, Megan?
Suicide Prevention Services in Batavia.
Thank you.
I do know a few of our needs. I just don't have the numbers that many of the other organizations had. If I could just have a minute of a few needs that I am aware of.
Yes,
I just was trying to,
absolutely.
I just was trying to get coordinated with my ED to see if she had anything she would like to add. We too are having, we have had some staff turnover, and we only have 2 vacancies at the moment, but we are working with the state for 988 implementation, which for those that are unaware, I do know that other agencies are part of this, such as AID. 988 will be taking over the National Suicide Prevention Lifeline. And with that, we will be dispatching to those mobile crisis units when we have a crisis caller. So there will be an increase in needs for staff, both on our hotline as well as supervision. And so we'll be looking for funds to help staff that when the increase of calls. For those that are unaware, the state of Illinois only has our crisis calls, we only have a 30% answer rate within our state. All other calls are transferred out of state because we only actually have 6 centers within the state that answer for the National Suicide Prevention Lifeline, SPS being one of them. So we'll be looking for additional funding for staffing that hotline and the supervision of that hotline.
Any questions? Any committee members have? Ms. Bates?
So you said that we have a 30% answer rate for our hotline. So the others are just redirected to other states. Where do they get answered there?
For the National Suicide Prevention Lifeline, yes.
So they're all getting answered.
They are getting answered, just not within our state. So the downside of that is other states won't necessarily have the same resources, the same area referrals that would be if they were in the state of Illinois, answered in the state.
And people need help here. So thank you.
Right. Exactly.
All right, any other questions for suicide prevention services?
Molina was a question.
Ms. Molina?
Hi, thank you for coming, Ms. Redman. Could you let us know approximately what the change has been in the last 18 months? If you've had an increase in calls or kind of an idea of what percentage you've noticed change here in Kane County of the need for services like the ones you provide?
We have seen, I don't have necessarily a percentage, but there has been an increase for crisis calls. We have seen depression, especially an increase in depression among adolescents, isolating and remote learning. We saw a drastic increase in our hotline calls. And now that students are back in school, we are actually going into the schools and we're seeing the aftermath of being isolated for so long. We've just this week, I've gone out to the school probably 10 times just for clients between myself and the other therapist.
And today is Tuesday?
Oh, I'm sorry. From Tuesday to Tuesday. Yes.
Wow.
And if I can also add, as a mother of a high schooler, I've noticed that on their IDs now, on the back of the ID is information to suicide prevention. And, I think that's a great thing that was added. I think there was some legislation that backs that. But I can see because of that too, now kids have a little bit more access to the needs that they probably haven't had in the past. And I thank you for the services you're providing them.
Thank you. Thank you for that. Thank you for your time, everyone.
Any other questions
Thank
from the
you.
committee? Okay, thank you, Megan, for being here. All right, next up, Latino Treatment Center. Do we have Adriana Trino?
Yes, good afternoon. Thank you so much for taking the time tonight to listen to all of our stories. To my colleagues, I feel your pain and I'm with you. I'm probably, sorry, my hay fever is killing me today. I'm going to be echoing pretty much what my colleagues have been stating. Latino Treatment Center, one of the major needs that we have right now, we are a very small agency compared to some of my colleagues. We do provide services for roughly around 300 people a year, all Latinx clients in the community, Spanish speaking. The programs that we had developed a program specifically for DCFS clients. These clients were people that were identified through DCFS and had to provide some type of outpatient services for substance abuse to be able to either retain custody of their children again or to be able to determine if the child should be placed again with the parent. They would come to us for the outpatient services to the point that just in the last fiscal year that just started in July, we've had pretty much a 30% increase with the DCFS clients, which has been kind of shocking. Right now with the DCFS clients, we do have a waiting list of approximately 18 due to the fact, the same thing that everybody's talking about is staff retention. Our program is designed for Spanish speaking clients. As you very well know, Elgin and Kane County in general has a very high Latinx population. So the services that we've been able to provide thus far after COVID has been a struggle. It's the same thing that my colleagues have echoed, trying to employ or maintain a staff member that has a master's degree, that is certified in substance abuse treatment, and that is bilingual with our salary that we're offering is pretty much impossible at this point. What we're looking for is also retention, being able to provide the staff that our community so desperately needs. As of right now, we're running at full capacity. I can't even begin to explain to you the love and the dedication that my staff has had during this whole COVID epidemic. We have not stopped working once. The majority of us had no idea how to use these platforms, Zoom. It wasn't something that we were trained in. So for my staff to be able to go from full on in-person groups to try to move an entire group or individual therapies, especially with the population that we work with, where the majority of those platforms were not bilingual and they didn't even have the option in the beginning to be able to show how to use it in Spanish, was just more than incredible. And the fact that I was not able to fully give them a bonus or to be able to praise them for all their hard work is disheartening. And it is one of the reasons why we lost 2 staff members, because of the burnout, because of their own personal issues that were going on with pandemic, and because of the shortage that we had at that point. So at this point, what we're hoping is to be able to develop a new DCFS program for these clients, be able to get these 18 clients that we've had on a waiting list into the program. And be able to continue to provide services for them. When we started this program, we started back in 2016, we were actually, one of the directors at DCFS reached out to us because of the need that they were seeing, where there was nobody in the community, in the county, and in multiple counties that could provide this services in Spanish. So the need is there. And like I said, we have seen a huge growth, especially during this pandemic with DCFS clients, especially with the children being at home. So at this point, the need just continues to grow. Sorry, I'm choking. So that's pretty much my soapbox. Does anybody have any questions?
Ms. Bates.
I should have asked this of every speaker, but you can probably answer it for me. Do you offer supervision for new social worker and LCPC graduates to get those 2 years of internship?
Absolutely, yes.
And
we also offer it.
Lori, do you do that? Do you, all of you? So that would be, are the students coming out of the colleges still?
So we are not. a mental health facility, our staff primarily has to have their CADC. So they have to be certified in substance abuse
CADC.
counseling.
Okay.
Yes. So it's a certification for substance abuse counseling. For that, the same thing. They do have to have 2 years of supervision. They are able to work with us because they should be doing in-person supervision for at least 2 years to get their credits, and then they would be able to sit for the test. Like I stated, though, for me to have an intern or for me to have a new employee, they have to be bilingual because all of our services are in Spanish and the groups are in Spanish. So that kind of throws another wrench into this whole staffing shortage and this work shortage that we're having, because we literally are losing people in the field every day. We've heard just ridiculous stories of master's degree people that have just graduated, have gotten their CADC, and they are literally making more at Walmart than coming into the field. So it's disheartening to see that people are just leaving because their livelihood are at stake at this point.
Okay, I'm thinking that by offering supervision, you could have a less paid employee for a year or two, but everybody's telling the same story. So it's loud and clear. Thank you.
Check the
Thank
chat
you.
area. Mavis, check the chat area.
What?
Check the chat area.
Check the chatter?
Chat area.
Oh, okay, yeah, I saw there was one from, thank you, from Bernadette. Thank you. I thought you said cut the chatter.
Keep it
Maybe
snappy.
that's what I should have said.
Okay, thanks, Bernadette.
Any other questions from the committee? Ms. Gums, you look like you're getting ready to say something.
I do have a question, but it's not for
Okay.
Teresa.
Okay. All right. Thank you very much, Adriana, for being here with us tonight and speaking.
Thank you.
All right, we'll move on to Family Counseling Service. Eric Ward with us.
Yes, I'm here.
Hey, how you doing tonight, Eric?
Hi,
I'm
Eric.
doing well. So thank you for taking the time today to hear the concerns in the mental health provider community. I'm Dr. Eric Ward. I'm the Executive Director of Family Counseling Service, serving the Kane County and other communities since 1925. Last year, we served more than 4,000 clients on a budget of just over $4.5 million, with the majority of those clients served residing in Kane County and 65% of them being child and adolescent. The number of clients seeking services was a 17% increase over the previous year. My comments will probably mirror those of both the chairman and the previous speakers. Our greatest area of need is funding that will allow us to more effectively recruit and retain qualified staff. Included in those efforts would be sign-on bonuses, retention bonuses, and additional professional development efforts. We employ right about 100 behavioral health professionals with an additional internship program that trains 8 to 10 new professionals each year. Last year, we had a turnover rate of 32%, up from a previous 5-year average of just under 9%. Included in that 32% were 7 bilingual professionals for an organization based in a community that is 43% Latino. The majority of those former employees left us after being recruited for higher paying positions at for-profit employers or hospitals. In addition to retaining existing staff, recruiting professionals to replace them remains a significant challenge. Currently, 9% of our positions are open while we continue to seek candidates, with most of those being open for more than 60 days. Because of that, we currently have a waiting list of 109 individuals seeking services, where our waiting list typically averages fewer than 20. Our organization has, for the most part, held its own financially throughout this pandemic. However, if we continue to struggle to fill open positions and to retain staff, that will not remain true. At Family Counseling Service, federal and state grant funds account for less than 1% of our annual budget. We rely on services provided and billed for by our staff. That model works very well for us, but only if we have the staff to serve the community and to generate the revenue necessary to sustain our services. Thank you for your time.
Thank you, Eric. Any questions for Family Counseling Services? Ms. Bates?
No. I cut the chatter.
This is Rob speaking. I was impressed with the 1925 date that they started. That's pretty impressive.
Well, we didn't actually start as a mental health agency. We started our mission being to deliver food, clothing, and coal to what the mission statement called the worthy poor, probably language we couldn't get away with today.
Look forward to your 100th anniversary coming up.
We do too. Thank you.
All right, if there are no other questions from anyone online, oh, Ms. Strathman.
What city are you in?
Our main office is in Aurora. We have a second office in Oswego that we're currently in the process of doubling in size, and we're already looking for a third location.
Thank you.
Uh-oh.
Ms. Bates?
So here's a question that could go for all of the other organizations too. Have you approached the city of Aurora, Eric, for how they're going to be using their American Rescue Plan funds?
We've had some initial conversations with them. At this point, they seem to be sticking to a guideline that requires that we show a significant decline in revenue to qualify for their funds. And we don't show that mostly because we've hired so many additional staff to try and meet the needs in the community. But as I referred to in my comments, we're hiring while losing, and so it takes time to get new employees up and ready and to carry a full caseload and generate the type of revenue that we need to support those positions. So we've held our revenue fairly steady, which unfortunately is going to disqualify us in some cases.
Okay. Oops. Very
Right.
ironic.
Ms. Baker, you approached the podium. Do you have something to add?
I did. I just was going to say that we've been reaching out to our Aurora alder persons and the mayor's office, and there's no clear guidance or process that seems to be happening at this point. So I'll just leave it at that.
That's funny. They didn't answer my call either.
I won't even, I get in enough trouble. People hate me already. So
Just
right,
cut the
Vern,
chatter.
but, yeah, but we'll talk later.
Okay.
All right, thank you, Eric.
Thank you, Dr. Ward.
Okay, that was the end of the list that I have, so I'll just go back to see if there's anyone that might be available. Anyone from, let's see, Prairie Wellness or NAMI. It looks like the people from NAMI are offline now. Easter Seals, Maureen Karwaski, Consumer Credit Counseling, Donna Rasmussen. Okay, I don't think we have any. Is there anyone else online that is representing an organization that did not get a chance to speak? Well, I think then we're pretty much.
Mr. Chair, I just have one question. Is Ms. Howe still on the line?
Deb Howe, are you still on the line? I see her name. There's a question for you.
I do apologize. I just was going through some of the wait list numbers
Your
here.
microphone. on.
Sorry about that.
You had to get right on top of them.
I just wondered if you could give me a number for your wait list, how many people you have on your wait list?
Ms. Howe,
It's,
did you hear the
yeah,
question?
yes, I did. I put some information in the chat. We have a lot of different programs, so we have a lot of different wait lists.
If you could estimate.
Yeah, I can't even estimate. We a lot of times we do it by so our substance use program, usually it would only take a couple days to get in at the most, and now it might, depending on the person's schedule and things like that, it might be over a week, 2 weeks, which is a lot when someone has a substance use problem. You don't want them to wait at all. The idea is to get them in as soon as possible, because if they have to wait, they'll change their mind.
Correct. I thank you for that.
Yeah. And with mental health, it's, some things we try to triage all of the requests. Like I said in the chat, our requests pre-pandemic were like maybe 190 a month. And now it hit over 500 one month. It's gone back down a little bit in the last month. So we triage the most, emergent needs, and we try to refer out some. We get some people into groups, while they're waiting. There's a lot of different things that we do to try to mitigate that, but it's not good,
Okay.
people.
I appreciate that. I was just going through the 9 organizations that spoke today. We have, 1,000 waiting list. And
Mhm.
that just disturbs me.
Wow.
Yeah,
So,
as it does all of us. Yeah.
yeah, and I apologize for the noise. I've got an in-app purchase on my calculator, apparently.
Okay, yes, I think that pretty much concludes this listening session on behavioral and mental health. Just hearing over and over again, we get people in, we train them, and then we lose them to higher paying jobs. We can't pay them enough to either get them or to keep them. I swear, I felt like I was in a Kane County budget presentation.
It sounds like Kane County.
It really is the same story here at Kane County, unfortunately. So it is hard to hear that too, especially because with this grant program, we're only, as of right now, at least, we're only going to be releasing $4 million in funds. And when there is so much of a greater need out there, 4 million is still a lot of money. But
the 4 million is a pilot program for the ARP program.
it's a way to get money out there more quickly as we go through our deliberative process of, the big picture of how we're going to spend the money, given all of the different uses that we have available to us. And that's going to take a little while. So yeah, this is, again, the need is great out there. I'm glad we at least have this going out right now in the short term. Are there any other comments from committee members or staff that have any observations or wisdom they'd like to share? All right. That being said, then I think we're ready to go. I will just ask for a motion and a second to adjourn.
Bates moves.
Bates moves.
Rothman second.
Thank you, everybody, for speaking to us tonight.
Yes, thank you, everyone who came and spoke to us. We'll be compiling this information. Please fill out the survey, and we'll be opening up a program hopefully in the next month as we go through our committee structure and figure out what criteria and what parameters we're going to have for this program. So we will definitely broadcast that far and wide once we put it together so that everybody knows. We'll have it in the Kane County Connects. We'll put press releases out, social media, all that stuff, so that anyone who is eligible can come in and apply to whatever the program is that we put together.
That's the portal when we.
Yeah, that will be the portal. No, it does it for me too.
I don't know.
It's never done that for me.
I guess
really.
I'm too close.
I have a soft.
But
P
that's
sound,
when we open up the portal, it will be in press releases. And
yes, absolutely.
Kane County Connects.
Yes, after
and-
the committee determines the parameters of the program, then the portal will be open and everyone will be informed of that. We'll have it open probably for about a month and then close it and start going through the process. So again, thank you everyone for being here. We have a motion from Bates, a second from Strathman. All those in favor of adjournment, say aye.
Aye.